antihypertensive drugs and antihypertensive drugs. Now the session will say about antihypertensive. So hypertension is most prevalent all over the world. People who are above age of 45 will be having the common cardiovascular diseases, hypertension. Now, hypertension is a kind of lifestyle disease. Most of the time, the way we lead our life may result in hypertension. Now, let us understand the details of hypertension. Normally, heart will be pumping blood. The blood will go to blood vessels. Understand this, whenever heart contracts, blood will be going to arteries. Right ventricle, when it contracts, the blood is pumped to pulmonary artery. Left ventricle, when it contracts, blood will be pumped to the biggest artery of the body, that is aorta. So when heart contracts, the blood will be moving to this vessel. Vessels are closed one, hence the ejection of blood will create a kind of pressure. That pressure is commonly known as blood pressure. Now, blood pressure is measured at aorta because the moment heart is contracted. From left ventricle, blood will be getting into the aorta. From that aorta, each and every part of the body will be getting oxygenated. If you check the pressure at that aorta during contraction, during the systole, the pressure will be 120 mm of Hg. 120 mm of Hg. When heart undergoes relaxation, it is called diastole. When you check the pressure at aorta, the pressure will be 80 mm of Hg. Since the normal blood pressure is considered as 125 Hg. This is measured in aorta. The systolic blood pressure is 120. Diastolic pressure is 80 mm of Hg. Now, when you say about hypertension, now hypertension is anything greater than or equal to 140/90. This is considered as hypertension. Now, again say, when we have anxiety, when you are doing work, when there is increased workload is there, heart will be pumping a lot of amount of blood to peripheral tissues. At that point of time, increased blood pressure will be there. That is not considered as hypertension. Sustained levels of pressure equal to or above than 140/90 is considered as hypertension. Even at rest, if someone shows blood pressure greater than or equal to 140/90, then it is considered as hypertension. Now, blood pressure again is given by, numerically it is given by cardiac output multiplied by peripheral vascular resistance. Now, let us understand these two terms. So, whatever the pressure is generated, it is a product of cardiac output and peripheral vascular resistance. Understand these words. Cardiac output I have already discussed. When ventricle contracts, blood will be ejected. The amount of blood that ejects out of the heart per minute is known as cardiac output. Cardiac output is a measure of efficiency of heart. In a healthy individual, about 70 kilo weight human being, the cardiac output, if left ventricle is contracted, each and every contraction is known as stroke volume. That stroke volume is per stroke. If it is multiplied with heart rate, we will get cardiac output. So this cardiac output is again given by stroke volume multiplied with heart rate. Now again, in healthy individual, stroke volume is about 70 ml. When left ventricle contracts, 70 ml gets into aorta. When right ventricle contracts, 70 ml will be getting through the pulmonary artery to lungs. Heart rate is around 70 beats. 70 into 70, 5 liters. Around 5 liters is cardiac output of a healthy individual. So every minute, heart will be pumping 5 liters of blood. The other part, peripheral vascular resistance. What do you mean by peripheral vascular resistance? When heart is contracting, blood will be getting into blood vessel. When blood will be there inside this blood vessel, it will be causing certain amount of pressure to these vessels, blood vessels. When blood is there, the blood vessel will offer certain amount of resistance. That is what is called as peripheral vascular, means blood vessel resistance. So if blood vessel is contracted, the resistance will be very high. If the blood vessel is dilated, the resistance will be low. So this peripheral vascular resistance is related to the diameter of the blood vessel. Getting back to what is hypertension. Hypertension is the pressure exerted by the blood on the walls of arteries. Blood pressure is the pressure exerted by the blood on the walls of arteries. The normal blood pressure is 120/80. If it is more than or equal to 140/90, it is called as hypertension. Blood pressure is given by cardiac output and peripheral vascular resistance. Cardiac output is again given by stroke volume and heart rate. Let me revise this thing. Blood pressure is pressure exerted by the blood on the walls of arteries. See, blood vessels are closed pipe kind of thing. When you have blood inside, the blood volume will be exerting pressure on these walls of arteries. That is known as blood pressure. Now, blood pressure is given by cardiac output and peripheral vascular resistance. When the normal pressure is 120/80, when it is above then or equal to 140/90, it is considered as hypertension. How do you treat this hypertension? Now, what is causing blood pressure, cardiac output, and peripheral vascular resistance? If you reduce cardiac output, if the amount of blood coming out of the heart is reduced, so the volume of blood will be reduced in the blood vessel. That reduces blood pressure. So, the way to treat hypertension is either you need to reduce cardiac output. What is cardiac output? Cardiac output is given by stroke volume and heart rate. If you reduce stroke volume or if you reduce heart rate, automatically it reduces cardiac output. The cardiac output is reduced, blood pressure will be reduced. What is the other parameter? Vascular resistance. When blood gets into the blood vessel, if blood vessel is dilated, what happens to resistance? Resistance decreases. Resistance means the inhibition to the flow of blood. When blood comes there, if it is dilated, blood will be flowing easily. If it is contracted, there is a resistance that increases pressure. If you reduce peripheral vascular resistance, what happens? It reduces blood pressure. So, all the drugs which we use as antihypertensives will be targeting these things. Now, out of these things, look at this. Cardiac output is under control of sympathetic nervous system. Why? When sympathetic nervous system is activated, sympathetic nervous system releases a neurotransmitter called noradrenaline. When noradrenaline is released, it will be acting on alpha and beta receptors. Beta receptors are present on heart. When they are activated, they increase force of contraction and heart rate. Both of them will be increasing cardiac output. What is stroke volume? It is increasing stroke force of contraction. Heart rate, again, both of them are under the control of beta receptors. So the moment noradrenaline is released, beta receptors are activated, cardiac output is increased. People do not have enough control over their emotions. If they are getting anxiety or angry frequently, they are releasing lots and lots of amounts of noradrenaline. When noradrenaline is released, it increases stroke volume, increases heart rate, it increases cardiac output. So in a way, the increased levels of cardiac output is controlled by our neuron system. So if sympathetic nervous system is activated, when you are in anxiety state, when you are in an angry state, noradrenaline is released, it increases cardiac output. Now, sustained levels of increase in cardiac output will damage our heart. Now, the other one is peripheral vascular resistance. I told you, if you use an agent which is increasing blood vessel dilation, it reduces peripheral vascular resistance. Second one, what happens if you reduce the amount of blood volume inside a vessel? When blood volume is reduced, the pressure offered is reduced. So, peripheral vascular resistance is again in the control of two things. One, blood volume. Second one, diameter of the blood vessel. Another one is blood vessel diameter. Now, the various agents used are, as this cardiac output is completely under the control of sympathetic nervous system, sympatholytics are used. Sympatholytics are used to reduce cardiac output. Understand this word. See, sympatholytics, again, we'll read it in autonomous nervous system, but let me briefly introduce you about these things. There are two different classes of this, sympathomimetics, sympatholytics. Mimetics, the word has come from mimicry. That means which are imitating. if any agent is imitating sympathetic stimulated action, that agent is called as sympathomimetic. What is the sympathetic stimulation action? By sympathetic stimulation, noradrenaline is released. It increases cardiac output. So if any agent is increasing cardiac output by acting on those receptors, it is called as sympathomimetic. Mimicry is acting like that. Now, sympatholytic, lysis means breakdown or opposing the action. Sympatholytic means if any agent is opposing the actions of sympathetic nervous stimulation, it is called as sympatholytic action. So when we use sympatholytic action, it blocks, it opposes the effects of increasing stroke volume, increasing heart rate, which reduces cardiac output. So this entire unit is under the control of sympathetic system. When you block that system, cardiac output is reduced. Blocking that system is known as, the agents which are used to block that system are known as sympatholytics. The other one, peripheral vascular resistance. As I told you, peripheral vascular resistance is under the control of blood volume, blood vessel diameter. Now, how do you reduce blood volume? Blood volume can be reduced by using diuretics. What are diuretics? Diuretics are the agent which will enhance urinary elimination. So they increase the urine outflow. When urine outflow is increased, when urine outflow is increased, extracellular volume will be getting reduced. We have intracellular volume and extracellular volume. Whatever the fluid volume is that inside the cell is known as intracellular volume. The volume which is present between the cells and in the blood plasma is known as extracellular volume. So the blood plasma has got extracellular volume. When people use diuretics, blood volume will be getting reduced. If blood volume is reduced, when the volume is reduced, the resistance will get decreased, blood pressure will get decreased. So diuretics will be reducing blood volume and hence they are used to treat hypertension. The other one, the blood vessel diameter. What happens when you cause vasodilation? When vasodilation is there, the resistance offered by blood vessels reduces. That means you are reducing peripheral vascular resistance. So the agents acting here are vasodilators. Vasodilators. So the agents which are dilating blood vessels are known as vasodilators. So briefly, you have got three major classes are there: sympatholytics, diuretics, vasodilators. So we'll say one by one. In the previous classes, I have explained about diuretics, so I will give you brief